Welcome to Prepare Now. My name is John. Today we're discussing heat exhaustion in kids. Due to the outbreak of heat waves throughout the Midwest and the western states, including other countries, including India and London, Spain, you name it, basically. I thought it prevalent to discuss how you can see, treat, and work with heat exhaustion, especially if kids are outside playing and they come in, and you can pick up on these symptoms and treat them appropriately. Just a little forewarned, I'm not a physician. I am not your child's physician. This is not medical advice for your child. This is simply first aid knowledge that you can use in emergency circumstance. First, we'll discuss symptoms. When you see heat exhaustion in kids, you see elevated body temp from 100 to 104, headaches, unstable walking, goosebumps, clammy skin, increased sweating and thirst, and muscle cramps and nausea. I've made slides so you can go back and check if you want to or print them off. Main cause in this is what you're seeing is, of course, increased heat outside, dehydration, and the loss of salt from sweating. The body tries to stay in equilibrium, and so when it gets pushed so far out, it's really good at keeping everything in balance, but heat and the loss of fluid, which makes up 70+% of our body, can really throw it out of whack. And that's when you start getting these funky symptoms or even more dangerous things. Of course, the treatments are for heat exhaustion in kids. Bring the kid inside. That's common sense, or at least in the shade if you can't get them inside an air-conditioned room. Try to remove any excess clothing. If they're outside, I know it's limited during certain things. I'd use cool towels, room temperature water. Anything cold is going to send them to shock, so don't shove them into a bucket of ice water. I would make sure that they don't go back into that environment. As much as they might feel better when they go start playing, I would check their temperature again. If it's still above 100, they're still showing signs, I definitely would hold off until all those symptoms are gone. Next, we'll discuss heat stroke, which is the next step in kids. Again, these symptoms are not for specifically just one or other. They become very fluid in between exhaustion and stroke. It's when you start seeing some of the big ones in heat stroke is when we really need to be worried and really be careful about. One being increased body temperature above 104 degrees. Absent of sweating, that means no sweating even though it's super hot outside. That's really a key thing that we look for, especially in the ambulance and whatnot. Confusion, disorientation, loss of balance, hot, dry skin even though it's extremely hot outside, loss of consciousness or passes out. That's a big bad one. You definitely call 911 immediately on that one. Increased pulse, increased breathing. It's our body's way of compensating for that increased temperature. Weakness, dizziness, seizures. So basically, if you see any of those signs, we're really wanting to get call 911, seek immediate medical attention because we've gone past body's way of compensating, and you're going to need IV fluids and advanced medical care. Next, I would, with a heat stroke kid, besides calling 911, I would go ahead and remove all clothing once you get them inside, get them out of the environment, of course, cool towels to the body, light fan. Again, call 911 if you're seeing these things like, loss of consciousness, anything neurological. It's a definitely need advanced medical care. Next, we're going to discuss heat stroke in babies. This is very rare but dangerous because babies, of course, cannot talk. They can't really tell us exactly what's going on. So we're going to start seeing signs like restlessness. They don't want to be touched. They're just always ornery. Vomiting, that's a key sign. Irritability, constant crying, cannot be comforted at all by any person. Lethargy, which is basically, it's the opposite from like adults. Kids, the smaller they get, when they get really sick, they get still. They don't complain, they don't cry, they just kind of almost look like they're half awake, kind of in a zombie state. It's the body basically shutting down. So when you see that, that's definitely call 911, advance medical care as soon as possible. Rapid breathing, that's one way the body can get some of that heat off. Due to the baby being so small, the surface area for sweating is so minute. So the body really can't compensate that well with high temperatures. We also see seizures in small babies more prevalent because of that, is because they can't sweat as much. They can't get that surface area, that evaporation. A lot of times they're sitting in car seats and strollers where they traps the heat. With kids, dehydration is mostly likely. It's pushed it over the limit. So big thing with babies is fewer than 4 wet diapers in 4 to 6 hours is a big telltale sign. Sunken eyes, facial expressions that look like, you can definitely tell. Refusal of food, water, or milk. Like if they won't take anything and normally they're hungry this time, that should be something that's, warning sign for you. When you do have a wet diaper, the urine has a very strong smell of ammonia. Also, it's very dark in color. That's showing that the child is dehydrated and it desperately needs fluids. Treatment for infants is removal from the environment. Basically, that's with everybody. I would call 911, especially with being babies, because babies and infants can compensate, and then they just crash. And there's no real forewarning before the crash. So I would definitely get the ambulance going. Worst thing happens is, they check out the child, and you talk to them and see what they feel is the best course of action. They can go unconscious. They can have seizures, so be very careful with that. I'd remove all their clothing, including their diaper. Diaper will hold in a lot of heat, so I know that sometimes is a faux pas, but if they're having a medical emergency, just do what you gotta do. Make sure the room temperature is between 70 and 80. Again, use Tempid so the body doesn't go into shock. I'd also offer water. I try to stay, or milk. Milk's going to be a little bit harder to digest, especially, or may vomit it. So if you see any vomiting, I'd stay away from milk for the moment. But other than that, I would just try to get water and get some medical care. Again, this is John with Prepare Now, and I hope this helps you out, and you guys stay safe this summer.